Welcome to the Microdosing for Healing podcast. I'm your host, Casey Garrett, and together we'll be discovering and learning from inspiring voices of healers, medicine keepers, and visionaries. Every episode, we'll explore the world of health, vibrant wellness, and natural medicine for a new era of human society. Welcome to today's episode. Hello, everyone. Welcome to the Microdosing for Healing podcast. Thank you for being here. So today I'm really excited to introduce you to three colleagues that I have so much respect and admiration for to speak on a topic that is so timely and I know touches all of your lives. So please welcome Vanessa Kreitz, Dr. Rick Barnett, and Joe Schack to the episode today. I'm going to share a little bit of their background and bios first, and then we're going to dive into a conversation centered around psychedelics, addiction, sobriety, and kind of reframing how we are approaching these subjects and topics in modern society. So thank you all for being here. To start off with, Dr. Rick Barnett is a person in long-term recovery from addiction to alcohol, nicotine, and other drugs. After he started his journey of recovery from addiction, he resumed his education to complete his bachelor's degree in psychology from Columbia University, 2 master's degrees in addiction and clinical psychopharmacology, and a doctorate in clinical psychology. Dr. Rick has been practicing as a licensed psychologist doctorate and licensed alcohol and drug counselor for over 25 years and currently runs a private group practice doing traditional psychotherapy, ketamine-assisted psychotherapy, and consulting around the preparation and integration of psychedelic experiences of all kinds. Dr. Rick is also the co-founder of the Vermont Psychedelic Society. Vanessa Kreitz is a recovery strategist and educator behind Sobriety of the Soul, a program for the integration of psychedelics into sober living. Combining evidence-based practices with spiritual wisdom, she bridges the gap between traditional recovery models and the potential of psychedelics to deliver holistic well-being. As a mother, former corporate executive, and person in long-term recovery, she prioritizes harm reduction and individual choice, empowering those on a recovery path towards soulful sobriety. Vanessa is also a microdosing guide, ceremony facilitator, and integration specialist. She has been walking a sacred medicine path for almost a decade and has nearly 20 years of sobriety. Joe Schack is the founder of Casa Vista Transitional Living for Men, and he has coached and mentored men in recovery for over 25 years. Joe dedicated many years of his career in some of the most prestigious treatment centers in the U.S. After years of working with traditional ways to cope with his depression, Joe began exploring alternative medicines and immersed himself in this new world. Doing so, he discovered a profound sense of inner peace and purpose. Motivated by his personal transformation and leading with compassion, Joe is committed to guiding and inspiring others on their individual journeys of healing and recovery. His practice provides a welcoming environment and is an expert in using innovative techniques to support and lead men in discovering their individual journeys toward living authentically in harmony with their truest selves. Thank you three so much. Just a few years of experience between the three of you. Beautiful. Thank you so much for your dedication to this work and this space and field. So let's begin with Dr. Rick. So Rick, society holds so much misconception around addiction. Can you share your take on addiction as a concept versus the conventional way we think of addiction? And some of the ways we can start to reframe addiction to approach it differently and more effectively going forward.
Absolutely. So happy to be here and to be with my esteemed colleagues, co-travelers on this journey. It's a wild ride. And it's been fantastic so far. And the question's really interesting because psychedelics, this is a psychedelic podcast. So psychedelics are seen as the great disruptors, right? They disrupt our traditional ways of thinking, the conventions that we're used to. Everything gets kind of, blown wide open and we rethink things. And so obviously the traditional ways to think about addiction and recovery, you introduce psychedelics into that and, we expand our understanding of these concepts. Unfortunately, we still live with so much stigma around addiction and even recovery, frankly. I'm in long-term recovery from addiction myself. And, it's not it's not easy to come out in this world, in this day and age, and say, hey, I'm in recovery, I don't drink alcohol. There's still stigma associated with even being in recovery. Like, why don't you drink? What's your problem? That kind of thing. And then also just in general, the stigma associated with addiction. There's things like junkies and addicts and clean time and, what it means to be an addict and what it means to be sober. We live with all these stigmas. So I think, it's helpful as we progress in this field of addiction, mental health, and recovery, that we rethink of addiction and recovery in more expansive ways. I like to think of addiction as an unhealthy relationship to behaviors or substances that interrupt our daily lives, that preoccupy our thoughts, our behaviors. And so changing that is sort of changing our relationship to ourselves, to the people around us, to the behaviors we engage in, to the substances we use. It isn't like a black and white kind of thing anymore. And I think it's important to think about that in terms of how we think about recovery. That might mean that, for example, buprenorphine and methadone, people use that as a tool to recover from opioid use disorder. Now think about psychedelics. Can we use psychedelics not as maintenance medications, but as, again, disruptors to our addiction and disruptors to our recovery, so we can expand beyond these traditional ideas of addiction recovery? And I think psychedelics provide a unique tool, a unique experience to be able to do that without sounding like a psychedelic elitist. I don't mean to come across that way at all. I think all tools that we have are important, including traditional medications. Psychedelics are coming online to be so important. So I'm really excited to be part of the movement in a healthy and nuanced kind of way.
Thank you so much. Beautifully said. Vanessa, next question to you. And the more guides that I meet and interview, it's become really, really clear the through line is always through our personal experience. In many ways, a lot of us become the guides that we wish we had originally when we were going through our own journey and process. So I'd love for you to share a little bit more about your personal background and experience and the way psychedelics have woven into your life and your healing.
Great. Thank you for that. So, as you mentioned in my intro, I'm a person in long-term recovery. This July will be 19 years of sobriety. And around the 12-year mark, two things were happening simultaneously. One of them is that personally, I was doing all the things that I was told to do in AA. AA is my lineage, recovery lineage. So prayer and meditation and service work and sponsorship. And I was a co-chair for a national women's conference that I co-founded and was doing all of this work inside of that program. And I was a seeker. I was doing the things that I was told to do, which is to perfect and enlarge your spiritual life and continue to grow in effectiveness and understanding. And so I was taking classes and I was reading books and I was taking Vipassanas and, just seeking. But I wasn't growing. There was this silt in the folds that I couldn't quite access with all of the other things that I was doing. And I had reached this level of stagnancy. At the same time, I had a partner who had treatment-resistant depression, who we were just trying to keep alive. And his life was like a rotating door of psychiatric facilities and treatment centers for many, many, many years. And we admitted him to a psych ward. And I got home that day and I did a Google search for alternative treatments for treatment-resistant depression. Now, I come from like hardcore black and white abstinence sobriety culture, right? Like the world of psychedelics was not even in my sphere at all. And I came across the work that Johns Hopkins was doing on treatment-resistant depression. And I think their other control group at the time was end of life fear for cancer patients. And it piqued my curiosity, and that opened Pandora's box for me. And I read everything that I could find. I listened to podcasts and all of that. And then I was called to the medicine. I really believe in the sacred call. I believe that our teachers arrive when the student is ready. And there was something happening for me personally that I knew that I had to continue to grow, and I wasn't doing that. And so my path began, and in listening to Rick, there's so much stigma and ostracization that happens within recovery communities. And I'm in this place where I'm being called to this thing, but like, what does this mean for me as a person in recovery? And so what was very important to me is that I was conscious, responsible, intentional, that the choices that I was making were based in information and community sourcing and finding people like me that could help me along my path. And I started with a microdose protocol and found a therapist in Atlanta who was willing to do facilitate an underground psilocybin experience for me. Was not the right set and setting for me, but I learned, and my journey began. And so, like, fast forward, I'm so committed to the safe and informed, responsible application of these medicines in the interest of therapeutic and spiritual aid, and destigmatizing the use, and I don't like the word use, but like the application of these profoundly powerful tools to help us address those things that are beyond the scope of the steps, that are beyond the scope of therapies we have tried, that are beyond the scope of medications we have tried. And so that's how I got into this path, and a little bit about how I integrate it into what it means to be a person who is in recovery.
Thank you. I appreciate all your passion and devotion, all of you, so much. Yeah, thank you. Joe, to line up my next question for you. So one thing that I have been seeing that's been remarkable this year on all of like my client intakes and applications, I'm seeing something for the first time where people have a higher expectation and what they want from their lives. You know, it used to be, I want to be less depressed, or I want to drink less. And people want more for their lives, which is so inspiring. And it's marking, I think, a big shift coming forth in our healing. And so for so many people struggling with addiction, you know, the goal has been set out to just stop drinking, right? As if that's the end goal, the end game, right? But then people stop drinking and they realize they're still deeply unhappy, or they're not feeling any sense of peace. So I'd love for you to share a little bit about your personal experience, because I know you got sober first, but then you were led to want more for your life. And I think that will resonate with so many people right now.
Yeah, thank you very much. And thank you for having me and being a part of this great panel. I think that speaks to our evolution, you know, as in treatment and in recovery. I think, you know, I got sober and I love that story. I felt like, you know, you told my story, Vanessa, because that's really it. You know, I lived my life in addiction for so long, and in that, what we refer to as pitiful and incomprehensible demoralization, right? You don't even know it. You know, it's like walking with a tack in your foot, and it just becomes, it was my way of being, you know? And then I got sober, and I got diagnosed with this thing called depression. And I had no idea what depression was. I just thought I had the flu every day, you know? And by the grace of God, I was introduced to a great, no nonsense recovery community. You know what I mean? It was just like, shut up, sit down, and do what's in front of you, you know? But I was also fortunate. I had this great sponsor, you know, and he was an indigenous person, and he had this little peyote bud growing on his windowsill, right? And I was sober. I was sober for 5 years now, just white knuckling it with this depression because I had done everything else. You know what I mean? I went to therapy. I took the medication. I prayed like my hair was on fire. I found prayer. I found meditation. I was of service. I had all of the commitments. I was on panels. I was doing all of this stuff. And I just got that this just needs to be enough for me. You know what I mean? Like, this is it. It's better than the pitiful and incomprehensible demoralization. It's better than spending the diaper money for heroin. You know what I mean? So this just has to be my baseline. And I went along with that for it's about 5 years of sobriety. And my sponsor pointed out that, well, that might be your solution one day, but you just can't tell anybody about it. And he was sober for a long time and really respected and known in our men's community in Southern California. And one day he had fired me as being a sponsor because I wasn't doing what I was supposed to do, but I was just in a relationship and I entered that relationship simply because I just wanted to kill myself. I wanted to get my kids back to their mom and get my life small enough so I could just end it all, even though I knew people were counting on me. And to get to that point is scary, and medicine got put in my life. I got called to it. I believe in that sacred calling. Just kind of things just started happening. And it's like, and then I remember that conversation with my sponsor. And I went back to him and he said, I'm here to support you, I'll help you, but you can't tell anybody about it, So I took that with me and I did that journey. And pardon my language, but it was fucking gnarly, man. It wasn't like, it didn't solve the fucking problem. It was like, I don't want to know that, but here it is. But what I got was choice in the matter, right? Like I got it. And it wasn't the setting for me either, but it started me on this beautiful healing journey. Again, absence of community, like nobody knew, right? So here I have this well-respected sober living in Southern California, sponsoring guys, and I can't talk to anybody about it, So I found yoga. I went to India. I did all of the things, and I involved as a person. I just put it in the back burner, and I can't talk about it. I can't do it. And I just think back about like, what if I had community? You know what I mean? Like, what if I could have talked to somebody about that? What if I could, bring this into my work? But again, I'm working in treatment. I'd worked in treatment for quite a while at that point. And it's the risk you're losing business. You know what I mean? You're losing support. You're losing all of that, and that's all that I have. But I think I love that what you spoke about. Like, I think people are getting tired of just doing time, antidepressants are ceasing to work. You got to take an amplifier to get that. And that, I get it. Like, medication has its point, has its place in this conversation for sure, Western medication, but it's stopping to work and it's just not enough anymore. You get to the 11th step, you're improving your conscious contact with your God as you understand God, but I'm still fucking depressed, and I still, I'm walking around looking for a place to hang myself, not to be graphic, but that was my story. You know what I mean? And I got to look back at all the men that I knew in this journey that didn't make it. They died sober because they, committed suicide. And it's sad. And to think that it didn't have to be that way. And part of that is because and now it's beautiful because these people that are getting sober now, they don't just have to settle, right, to be less depressed, because all of a sudden, okay for us to talk about the disruptors, there's another avenue to go down. So, so that I don't know if that answers the question, but that is my experience with it. And so thank you.
Very, very much so. Thank you. Yeah, Vanessa, I'd love to go back to you because both of you just spoke to this. It's what's keeping people, what's holding people back from experience this greater level of healing and experience of life is the stigma, right? And so I'd love to know, for those I know there's going to be many, many people listening that have varying degrees of some fears. I even with microdosing, I receive people who are in the program. And even if they have done all their research and homework and feel very confident and drawn, they're like still have to answer to their spouse, their family, their sponsor. So for everybody who is listening that this is relevant for, I'd love for you to share how you work with people with overcoming stigma. What are some of the resources you use and what do you share with them?
Yeah, Casey, thank you. And Joe, thank you so much for sharing what you did. And I want to speak to the suicide rate among people who are in recovery. In almost 20 years of sobriety, I have been to more funerals of people who took their lives as active, sober members than I have been to funerals of people who died in, from an opioid addiction, an opiate overdose or active alcoholism. And there is an epidemic within our community of disconnection. And we hear, right, the opposite of addiction is not recovery. The opposite of addiction is connection. And so here we are in the rooms, or whatever our path of recovery is. There's so much research. It's on it's splashed everywhere about the benefits of psychedelic medicines, and Joyous with their new microdosing ketamine ads are, popping up every 3 posts on Facebook. And there's a ton of research happening. And so how can we not see that? Right. And so if somebody is called, and what I'll say is that psychedelics are not for everybody. And I'm using the word psychedelics as the broad umbrella term. Ketamine is not a psychedelic, it's a dissociative, right? We've got empathogens and theogens, psychedelic medicines, dissociatives under that umbrella, and they all have their value for sure, and they are making incredible differences for people. And when people, to answer your question, when people come to me, it's one of the biggest fears that they have. I'm going to lose my people. And I'm going to be, and that's actually what has happened to many people I know who were trying to heal something that all of the other methods they tried did not work. And so they come in their curiosity and in their like vulnerability, and they say to their people or their sponsors or their friends or their fellows, and they're like, I heard about microdosing, or I heard about this thing. And, they have an X on them immediately. They are judged, they are criticized, they are ostracized, and they are exited in many cases from their communities at great, great harm. And if within the traditions of Alcoholics Anonymous, if our common welfare should come first and personal recovery depends upon AA unity. And what our purpose is to continue to grow spiritually, to continue to seek spiritual exploration and healing. Why are we sending them away? If what they are doing is literally what the material says, why are we sending them away? So part of the very first thing I do is I tell my story, and what I'll share a little bit of it is I share with them, and what I'm about to say I recognize is not by a long shot what most people experience in their fellowship communities. Is that when I went to my sponsor and I said, I'm thinking about microdosing, and here's why, and here's what it is, and all of that. And in the most masterful sponsorship, she said to me, Vanessa, I know nothing about this path that you're getting ready to embark on. The only thing I ask you to consider each step of the way is it bringing you closer to the light or away from it? And so what we're talking about is, what is our intention? My litmus test for whether or not it falls within the category of use, like using, or falls within the category of what we are called to do to perfect and enlarge our spiritual life. The litmus test is, am I seeking to numb, escape, or avoid? Those are the 3 things. So that's like the first part of it. The second thing I share is the other part of my sponsorship story. When it was about a year and a half in, I've got 2 sober sisters who are all up in arms because they each have a sponsee, double-digit years, who are using cannabis in a way that sounds medicinal to me. One of them is like for a chronic pain condition. I don't remember what the other one is. Nobody knows. Nobody in my recovery community knows except my sponsor that I'm like every 4 weeks, I'm either in service or sitting with medicine. And I'm like really active there. And I'm studying about psychospiritual integration, and I'm leading integrations because I've been doing that coaching work for many, many years. And I'm part of the guardianship program, and I'm invited onto the church council, and I'm part of the core facilitator team now. So I've got this whole like psychedelic world happening, and I've got this whole AA world happening. And what their message was about their sponsees is they are not sober. They have no business being in AA. They need to resign their service positions. They are not sober. And so I called my sponsor. And the reason I shared this story is because it changed the narrative, and it changes the narrative. And here it is. I called her and I said, "Am I sober?" And she said to me, again, in the most masterful sponsorship, "Vanessa, I know nothing about this path that you are on. Is it bringing you closer to the light or away from it?" And I said, "It's bringing me closer to the light, Polly." And she said, "How you find God is an outside issue. And are you sober? More sober than you've ever been, baby girl." And it was in that moment that who I was in my recovery community and who I was and what I was doing on my spiritual path and in my medicine community integrated. And there was zero conflict with the work that I was doing. And so the very first thing that we do, clients who come to me or in recovery and they're seeking to approach this path, is we get really clear about what does it mean to be in recovery. For them, how to personally define, and this is one of the things that I learned as a member of Psychedelics in Recovery, the 12-step fellowship, right? Like personally defining for myself, what does recovery mean? And we get down into the nitty-gritty of what are our beliefs, what are our core limitations, what are our boundaries, what things are off limits. We do deep intention setting beyond just an experience that they're having, but taking those tools and skills around intention setting for medicine work and taking that into who am I as a person in recovery who wants to do this work? What are my intentions? So that they have the foundation and they can, rest back into that as they begin their path. And so it sets clarity. And so that's how I start.
Thank you so much. Rick, over to you. So a lot of people, especially people who are wrestling with having someone to talk to, right, need to start with the internet in their research journey, right? And so in some ways, it's great that psychedelics have gone mainstream. There's a lot of information out now. The downside is there's a lot of information out now, right? And can be completely overwhelming to people. There's a lot of misinformation as well. So for those people who might be brand new to psychedelics, who don't even know where to start, could you share a little bit about the different types of medicines people are talking about? And psychedelics actually really encompass a wide array of substances. And from your experience, which medicines are appropriate when someone is moving into getting sober?
Thank you. There's so much to riff off of what everybody else has been sharing so far. It's one theme that comes up is community and how important community is. We're a little community right here, right now, having this conversation, and communities exist in so many different shapes and forms and qualities. And, I think that's an important foundation when it comes to this work, and really not only being called to the medicine, so to speak, but being called to various communities that feel safe and ethical, and, vetting those communities and trying them out. It's really important. Those communities can be found online. So to your question, Casey, there is a lot of information out there. It is hard to, wade through all the different resources out there. I think if people do their due diligence, Vanessa mentioned Johns Hopkins, and there's institutions that, their websites we can go to, MAPS, the Multidisciplinary Association of Psychedelic Studies, and USONA and Beckley and Imperial College. And I actually did a talk a few months ago, and I just was, for the talk, I was looking at all the different universities and institutions around the world that have some sort of like psychedelic research or working group or something like that. And it's proliferating like crazy. So there are venerable, respected institutions. I think that's one resource. I tend to be, and I encourage people to find information from all resources, not just the science, because the science has got us here. It's the reason why we're having this conversation. If it wasn't for all the research done, not only back in the 50s and 60s, but really more recently with the stuff that started in the late 90s into the 2000s and now proliferating all over the place, we wouldn't be here. But that's not the only place to get information. Most people in this society will turn to the medical community for legit, the FDA, the Food and Drug Administration, the all that stuff for legit information. And I think that would be short-sighted, because there's so much good information out there from people like Casey and from Vanessa and from Joe and from so many other people that aren't affiliated with these institutions that have been doing this work for so long, and they know their stuff and they're safe and they're ethical. But there are some challenges. There are things like cults and people who get involved with this with more nefarious intentions. And so to your question, and to what Vanessa also mentioned, was there's a lot of hype around psychedelics and there are some harms, and we need to talk about both. So they're splashing all over the newspapers and scientific journals as psilocybin cures this and MDMA cures that. And, now there's 5-MeO DMT, one experience and your depression's gone forever. And, all these claims that I think, again, got us here. And it's important that we're having these conversations, but there's harms, it's not appropriate for everybody. And also to Vanessa's point, it's something I think about a lot. At what stage in somebody's addiction or recovery are psychedelics appropriate? Should they be, if they're in their active addiction, should they do high dose, psilocybin journey? If they're, 6 months in and, just learning how to be sober and learning how to figure out how to live life and, throw in some 5-MeO right then, there's no like hard and fast rule. I think we need to take it on a case by case basis and really understand where the person's at and see if it's appropriate for them, regardless of their stage of recovery. 30 years into recovery, it may not be appropriate for whatever reason. So we need to take a look at that. But, to the specific molecules, it's so hard to say. I mean, psilocybin and MDMA and ketamine are the main three that have the most research on them, that are the most widely used, whether in research trials or out there in the underground. And those are the three, I think, to look to specifically in communities, various resources, research, and other communities to find out the best information we can. And yeah, do our research. Research doesn't mean like scientific, but do our own personal work in looking to find the best information we can. 5-MeO DMT, ayahuasca, which is regular DMT, basically, those can be pretty intense, and and I think they have incredible potential, and a lot of people find incredible healing with them. But it takes a level of sensitivity. And then there's a lot of other like novel psychedelics or lesser known psychedelics that are starting to become a little bit more mainstream. But those are the three main ones: psilocybin, MDMA, and ketamine, which again isn't a classically psychedelic, but it does. In recovery, I've had 2 ketamine experiences, and they were profound in their own way. Short-lived, but I could definitely see how they could be helpful for people. So that's why I do work with ketamine in my office. But it's not for everybody, and it has a slightly higher addictive potential. We've seen that a lot in recovery communities, people using ketamine and then misusing ketamine. MDMA, I think we need to be mindful of that as well, coming out as it gets more and more popular, that people in addiction recovery can, possibly run into trouble with MDMA as an amphetamine kind of like experience. Psilocybin and LSD and DMT a little less so. So that's something to keep in mind. I wouldn't say that psychedelics are anti-addictive, though. There's a lot of rhetoric out there about them being anti-addictive. I think there's a small percentage of people, I might even include myself in there, where, any kind of change of consciousness, that preoccupation, and like thinking about when's the next journey? I can't wait to do it again. Which molecule should I try? When can I do it? Who's got it? All that sort of obsession that, we need to be mindful of. We need to hold ourselves accountable and share about that with others so that, we don't find ourselves going off the rails, even with psychedelics.
Thank you. Appreciate that very much. Joe, next question for you. One of my great lessons in working with people and supporting people microdosing who are moving through addictions is it's often really necessary to loop their loved ones in to their journey too. A lot of times they've done so many things toward their recovery. And this working with psychedelics is so different because it's not just working with the addiction, it's working at the core and the root of what is underlying that addiction. And sometimes that's the first time in their life they have ever touched into that, like what's underlying everything. And so the experience is often very different than they think it's going to be. In the past, they had done things through will or numbing. And as you described, your first journey was gnarly. Psychedelics offer us big honesty, right? And so a lot of times people aren't aware of that. So I'd love for you to share what can people expect and how is healing with psychedelics different than perhaps other treatment modalities they may have experienced before?
Absolutely. I think that's great. I love what Rick was talking about as far as addiction. Because look, I was addicted to yoga. I could be addicted to anything that's going to change my consciousness for 20 minutes or an hour, whether it could be chocolate cake, it could be heroin, it could, you name it. So I love that. And I think that is my responsibility when I sit down with a man and I'm doing my assessment that's my job, is to get in there and figure that out and make my recommendations and to meet them where they're at and get them to challenge them for sure. And the call, set the boundaries and all of that work as a clinician. And I think as far as support groups, families, all of that, I think, look, addiction, it affects. Not the addict gets to get loaded to not deal with it. And anytime that they're getting loaded or they're getting sober, the family is affected. It's not just the alcoholic or the addict or the person in recovery. So it's important to involve them because they're suffering as well, if that makes sense. So I think, the easy answer to that, if you bring with families is, the easy stuff is, lead with your heart and set an intention. Don't set a boundary you're not going to be able to enforce. That's the easy stuff. But it's like conversations like this. You could take all the notes and then you start to have the conversation. That's when the human heart shows up. That's when the emotion shows up. That's when the feeling shows up. And if you're in a conversation with, somebody that you've been in a relationship for a long time and they've been suffering for addiction, you are affected. There's anger, there's sadness, traumatized, depending on how long you've been in that relationship and in that journey. So, to involve them and to educate them, you can do all of that stuff. And no matter what happens in the addiction or in the journey or in the recovery, the most important thing that I always share with my families is you have to do your own work. You can't expect the identified patient, the addict, call them whatever we want to identify them or label them. They're going to do their work. And everything they do is going to touch you. It's your responsibility to heal. And so often you see it, I just share this all the time. I'd get a guy in my house and I'd work with him for, he'd be in my house for 6 months and they would be doing all this amazing work, growing spiritually, just this huge transformation. You see the lights come on. It's beautiful. We've all seen it happen and it's beautiful. And it's why I do this work. But then at a certain point, the family is reintroduced into the conversation. The family hasn't done any work. The family's just, expecting to fix my kid, So you introduce them together, and it's easier for the person in recovery to go backwards than it is to pull the family forward, right? So the real work is to encourage the family to do their work, no matter if we're talking about, going into treatment or we're talking about recovery. We are all affected, and we all have to do our own work and not have the expectation that the other person is going to fix me. You can have all the hope in the world, but the expectation is just simply a recipe for a resentment or a disaster, So I think having open dialogue, the short answer is lead with your heart, talk about the elephant in the room, ask the questions, be open to the response, even if it's not what you want to hear. And just love, man. You know what I mean? Like, just love one another and be there, and man, sharing all of it, because there's nothing like there was for my mom, right? My mom, when I was gone and I came back and I wasn't welcome, and then she saw me and she knew something had changed for me. There's nothing like that. That is priceless, and I'm fortunate that I get to see it happen all the time, right? And I just want these families to heal. Don't expect your kid to heal you, man. Your kid's, he's an addict. He's an alcoholic. He is suffering. He's going to buy into instant gratification, which Rick was kind of talking about. It's like, yeah, fix me now, man. That'll work. I'll take that. Let me try that, So whether it's prayer, meditation, or some sort of substance, we're always looking to be fixed. So so let's do our own work, right? And let's heal ourselves so we can be a part of the healing journey for the people in our lives that we love.
Thank you so much. So my next question, Vanessa, it's so obvious to me how much heart and love and passion the three of you have for this work. And I think all of us in the field have a great fear. We don't fear the medicines. We fear humans are going to fuck this up.
Yeah.
Humans are going to be the ones to fuck up the potential that we have in front of us. So I'd love for you to speak to some of the concerns that you see. You spoke a little bit about, the ketamine ads running through our Facebook feeds nonstop. What are some of the concerns you have, and us who really, really care about this work? Can we all kind of pitch in and help steer the collective in a healthy way?
Yeah, thank you, Casey. And I'm so delighted to be in this space with all of you. I just want to take a moment to just really deeply acknowledge the voices in this room. Rick and Joe, thank you. And Casey, thank you for orchestrating this. I think this is such an important conversation to be had. I would say across the entire psychedelic landscape, people in recovery are the most at risk, the most underrepresented, and the most marginalized. And so thank you for creating this space where we can have open dialogue about this. And because the question you just asked me is so significant, I would love to hear Joe and Rick after I answer, if that's okay. And both Rick and Joe have mentioned this, is that we have, those of us who are in recovery or have a history of addiction, or perhaps are even actively in addiction, we have an affinity for altered states of consciousness. If I can change how I'm feeling in any given moment, it's better than how I'm feeling right now. Even if there are consequences, whether it's like a gluten allergy and I'm insisting on having a piece of cake, right? We want the dopamine hits, right? And there is a real risk. And I think these conversations are so important because we have to normalize the dialogue. We have to normalize the conversation so that other people in recovery can hear these conversations happening and be better informed about the decisions that they're going to make on their own behalf, right? With ketamine in particular, we saw what happened with Matthew Perry. Ketamine did not kill Matthew Perry. He died by drowning. However, and I am totally speculating, and I recognize I have no right to do this and nobody was there, but I imagine that he had been like, I know he was like 8 or 9 months sober, and he was doing all of these things to try to continue to heal. And what happens when we recover from the substance or the behavior is that it actually opens up and reveals all the reasons that we drank or used or compulsively behaved to begin with. And so we may be in a state of suffering, and there is a degree of desperation to heal ourselves. Alcohol, drugs, sex, the behavior, whatever it is not the problem. It is the answer. It is the medicine. It causes unbelievable consequences. But it's how we treated that irritable, restless, discontented, the being in my skin so painful, walking around this earth that I could compare it to being skinned alive and lit on fire, right? So knowing that about people who are in recovery or are in the throes of addiction, having these conversations and making sure that industry also includes education for their practitioners about what it means to treat people who have a history of addiction. That's really, really important. Not only, it's twofold, right? And I'm actually in the process right now of working with Jen Bruce from Humans Can Heal and Keely O'Ryan from Plant Allied Recovery to address this unbelievably life-saving need in the recovery community where we must, all of us must no longer put it on the person who's in recovery to do all the educating and then to educate up, not only in our communities and our fellows, but also our medical practitioners, but instead to make sure that everybody at the top is educated, can educate down. So people who are in the recovery world business, recovery coaches, interventionists, psychiatrists, addictionologists should be informed about psychedelic literacy for those patients of theirs or clients of theirs who are seeking psychedelic assisted therapy. On the other side of that, people who are treating in ketamine clinics, therapists who are using MDMA, not even just professionals, people who are in the underground, medicine workers in the underground. I'm one of them, right? We need to be we need recovery education, recovery literacy. What are the differences? How do we need to be speaking? What things do we need to keep in mind and consider? And so making sure that those resources are available and our community doesn't fall through the cracks. So that's what I have to say about that. I would love to hear Joe and Rick if they have anything to say about it.
First of all, what else is there to say besides what you said with so much passion and vigor? It was just amazing. It's beautiful. And I agree with you 100%. I think it's our responsibility when you work in treatment. Recovery is recovery and treatment is treatment. If you're going to take on a role and work with somebody, because you're dealing with somebody's life first and foremost, right? That's what we're dealing with. And you don't, especially the evolution of addiction and the drugs that people are taking, we have to make sure that we are educated so that we can pass that along to the person that we're working with. And look, when I first got sober, I remember when people were talking about SSRIs, and that was taboo in the rooms of Alcoholics Anonymous at one point. Going to treatment was, that was taboo. And I just think, as things get presented, like this world of psychedelics is getting reintroduced into the recovery community, and we're talking about it, so we're making it okay, which is beautiful and the most important piece, because we have choice in the matter now, right? It becomes an option to go and take a look at and to educate ourselves so that we can pass that on. Because again, we're dealing with someone's life and our intention is for them to heal, right? So I think, look, if I'm going to work in the treatment industry, it's my job, man, to roll up my sleeves and go and learn about all these different options, whether it's harm reduction, whether, there's so many different ways to get to where we got to go. It's not just about, prayer and meditation or, getting a commitment. It's not just about AA. There's smart recovery. There's, you name it. There's just so many different ways to get there. My job is to educate to myself to all of those, avenues so that I can make a difference with the person that I get to work with, if that makes sense.
Yeah, I would say also, Vanessa, your use of the phrase psychedelic literacy is very poignant. I think also what you said at the beginning is, with all the humility at my disposal, I feel that people with lived experience with addiction, inactive addiction, people at various stages of recovery from addiction, I think are the most important voice in the room, over and above the research and over and above some even practitioners, underground practitioners who don't have lived experience. I can tell a personal story about that. There are people who are very masterful in their providing medicine in a very safe and healing and effective way, who don't know shit about addiction recovery. And I won't share the story here, but for another time, I think that voice is so important, because we all know the expression, people with addiction have a hole in their soul the size that you can drive a freight train through. And we live with this seeking, this yearning for connection, for freedom, for joy, for whatever it is we're seeking. And we find the medicine in alcohol and sex and food and, drugs and all that kind of stuff, trying to find that thing that fills us up, that feels good. And because we have such deep experiences with that, to tragic consequences, once we are on the path of recovery, even if we're fumbling, this is one of the most important voices in the room. We know what's up. And if that voice isn't firmly represented, you're right. I mean, they're marginalized voices, they're stigmatized voices. There are voices right here in the room right now, that there are voices that they need to be heard. I happen to be somebody like Joe and like some of you. I cut across so many different domains of advocacy, policy work, clinical work, personal recovery, community building, people, all those things. And so I am very passionate about raising our psychedelic literacy, a psychedelic IQ, and knowing what we need to know about this stuff as much as possible, and trying to avoid, this is huge, trying to avoid the polarization that occurs, that this, the medicine workers in the indigenous community, they know all of it. And they have a voice. They need to be heard. The research needs to be heard. People in recovery and active addiction, we all need to be heard. It isn't us against them. We don't need to step on each other's toes. Everybody has strengths and weaknesses. We need to bring all voices to the table. And I think that's one thing I'm very passionate about. Some of you who follow me on social media, I'm all about trying to find that nuance and trying to stay away from, cheap jabs at each other for this or that or the other thing. It's hard to do because we are so passionate about this, and I fall into those trappings too. I'll make a snide comment here and there, and I try not to. And it's really important to try to maintain that sense of balance, the broadest perspective possible. We all have a voice. We all have something to share, and we all have our blind spots. So let's try not to sort of step on each other's toes and fight against each other on this or the other thing. Let's keep this community safe. Let's keep it ethical. Let's keep it connected rather than fragmented and, falling into those trappings. So it's a great question. Thank you. Thank you for that question. And both your comments, spot on.
Thank you all so, so much. Rick, you really touched on my next question for you, which is, one of the things since we have known each other that I most respect in you is you are a bridge builder in the space. And you very much hold out, yes, there's the scientific reasons behind this work, but there's also deeply spiritual reasons, and you make of all the many, many psychedelic conferences out there, and there are many these days, I receive so much incredible feedback from your conference that you hold annually called Soul Equinox, right? Held September in the equinox each year. And the feedback that I have received from that is people love that there was both. You really made space for the researchers and the academic, but you also made space for people who've been doing this work in the underground for many, many years on the same stage. And I just want to say thank you and celebrate that you hold that space for all of us. It's so important to be seen together. I think to share each other's voices, not just kind of listen to each other, but also kind of give each other the support and share the stage and the mic together. So thank you for doing that. I would love if you have anything more to say on the subject of how we can weave kind of the spiritual side of this work into our very, very mainstream medicalization of this work that we hear right now.
Thank you. And the conference is really a labor of love to put that on every year. We get some great speakers. This year, Robin Carhart Harris is coming. He used to be at Imperial College, well-known researcher in the field. Chris Timmerman, who took over for him over at Imperial College, is coming. Manesh Gurn, all heavy on the science side of things. But then we have Sutton King, who is just an amazing woman to talk about the sort of the lineage, the sociocultural lineage, and such an important voice in the space. Also, Victor Cabral, and so many diverse voices. So trying to bring in this sort of the sociocultural, spiritual, and scientific into the same space, it can be done. I've seen it. It can be done. It's difficult. I need to prep all the speakers each year to say, hey, this is what we're about. It's called the Psychedelic Science and Spirituality Summit. And we want to have both voices at the table, both have an important piece of the puzzle to contribute. And, it's important not to step on each other's every time. It's super respectful. And somehow the alchemy that manifests during these conferences is just, it's amazing. I've been to many psychedelic conferences, and there's a lot of stuff on science and research, and seems to be that the medicalization of psychedelics is for better or for worse, it's the model that the broadest general public audience is willing to listen to. The spiritual is still seen as woo-woo, and it's difficult. Even the history of AA, and Vanessa knows this very well, and Joe too, like the spiritual side of things, mentioning the word God in any of those, in early AA, even today, even a person who's been in AA for a long time, I had so much trouble saying the Lord's Prayer. I did not grow up religious at all. And there's so much religious language in 12 step, and it's still very difficult for people. Psychedelics aren't going to be any different. It's very difficult for people to understand the sort of the lived experience of these spiritual things that happen under the influence of psychedelics. Not only that, near-death experiences, breath work, yoga, all that kind of stuff, but to really embrace that and get that to be a main piece of the conversation is still quite a challenge. And so as a Western medical provider, a voice in that, I actually try to de-emphasize the Western medical model and emphasize all the other rich information we have at our disposal, because the medical stuff is going to take care of itself. We don't need another voice for that. We need to have, again, bridge building. We need to come together with our strengths and our weaknesses and take a collective deep breath and bring this material, these substances, these experiences into the world in a healthy and ethical way. And no one has the corner of the market on that. We are in this together.
Thank you deeply. Mm-hmm. Joe, back over to you. So I would love for you to speak to people who are expressing just so desperate. They kind of feel like they're pinned to the wall. They have done everything. And there's a sense of like desperation sometimes I sense in people, like this is if psychedelics don't work, this is the last thing. Like, this is the last try. You're my last hope, as my guide. So for people who are in that state, can you share a little bit more about what working with microdosing or psychedelics actually is versus what they think it might promise them? And any other advice you have about when people are in that space, or if someone who is listening has a loved one who is in that space, some guidance around that.
Yeah, I can speak to my own personal experience. When you said that, that was me. And I think I wish somebody would have told me that it's not going to fix me. I wish somebody would have told me that it's not going to solve my problems. I wish somebody would have told me that it wasn't going to do the work. I wish somebody would have told me that it could be fucking gnarly. I wish somebody would have told me that, get ready and make sure you're surrounded by a bunch of people who love you, that can support you and hold you. And as you do the work, because that's when the work begins, You talk about desperation, and my eyes cleared up, because anybody who is suicidal knows, we know people are counting on us. We have our children, we have our dog, we have our wives, we have our clients, we have our business, and that keeps us, right? Keeps us moving forward, keeps us looking for some sort of solution, some sort of relief. Because if you're an alcoholic or an addict, that, for me, drinking and using was off the table years ago, and suicide became an option. And to get to that point where you just don't fucking care about the people counting on you anymore, To get to that point, by the grace of God, I never got there. I'm still here to talk to you, But so many of my friends, so many of the men that I came up with, they're not here, And that breaks my heart, So I think it's, I wish somebody had told me what it wasn't going to do for me, instead of, telling me it was going to fix me. I wish somebody would have spent some time with me. I wish somebody would have talked to me about microdosing instead of saying, go take a bunch of ayahuasca. I wish somebody would have done that. And it was 10 years between journeys. I did my first journey, and I got it was like doing my fourth step on steroids, right? I lived all of that stuff. But in that moment, I knew I wasn't done. Like, I knew I'd come back to medicine. And then, and even then, like, I wish somebody would talk to me about microdosing. It's not it's my responsibility, right? I'm looking but I didn't know microdosing was a thing, just like I didn't know AA was a thing when I decided to get sober. But I didn't know what a detox was, So I wish somebody would have educated me to that, to let me know, hey, why don't you start up with a microdose? Let's check that shit out. You know what I mean? Like, let's see let's see if we can get some, some information there and do that work and have the support. And again, community. Because for me, look, in the 12-step community, 12-step recovery, the steps are magic. They are. They're just magic. I don't know how they work. I know they do work. But the fellowship was priceless for me. And I just wish I could have had that, like, combine that with my psychedelic experience. So again, if we could bring that to the table, which we are, man, you folks are so amazing in the work that you're doing. I'm honored to be in this conversation, because it's clear that we are all committed to helping people heal, right? And that's what it's all about. So yeah, I don't know. I probably got off a topic there because it's something that really affects my heart, But yeah, man, we just need to know that it's not going to fix us, man. And it's an option. It's an option if you're ready to do the work, if you're willing to, pray like your hair's on fire, and make the midnight phone calls, and and all of that stuff that needs to be done, like we did when we were new in recovery, Like, if you're willing to do that work, then maybe it is an option for you. But if you're just looking for a fix, it's not going to fix you, man. You're just getting started. It's like just the door's open, right? And who knows what the next door is? I don't know. But let's get through this door, right? And check it out. Let's go check it out and see what happens, So.
Right on. Thank you.
Yeah. Casey, can I speak to that for
Please
a second?
do. Yeah.
First of all, Joe, I'm so moved by your share. Thank you so much for that. And it makes me think about, and we've talked about this, is that all we're hearing out there is it can treat this and treat this and treat this. And there's this medicalized allopathic model that's starting to rise up that if I have depression, I can go and get they say it's ketamine assisted therapy. They say it's ketamine assisted therapy. However, what is popping up all over the country are clinics run by anesthesiologists where you go in, they give you your dose, and then they send you on your way. And they're like, we'll see you next week. That is not ketamine assisted therapy. That's a ketamine infusion, right? And so if the model is that you go and you have your 6 weeks, and part of that is a more holistic approach, and that's not being offered. I have friends who are now 2 years into ketamine treatments for depression because they don't have the integrative therapeutic support around them. Right. So I wanted to bring that to bear too, is like, we have to talk about integration. Like Joe was talking about, it's not going to do the work for you. It is not a panacea. It just opens the door. It makes the unconscious conscious. And then what? And for those people who are 12 steppers, like it literally is like a nuclear step 4. And so once you've done step 4 and you know all the stuff, you can never not know it again. And what is your choice to be? What are you going to do with all of that information? And so if we're not also weaving in the conversation about the work that we have to do, that it is not going to fix us, but it just is going to begin the process of our healing. And are we committed to doing all of the work that needs to be done beyond that? That's Joe, thank you so much. It's like really an important part of the conversation to be had.
Yeah, and I'll just add that it's the psychedelics and recovery community that Vanessa had mentioned earlier. It's a sort of a 12-step lineage program that integrates psychedelics into traditional 12-step recovery. Like that's the kind of community for people who appreciate that model. Some people don't, but for those who know that model or appreciate that model or are curious about that model, it has a built-in fellowship. It has a built-in step work program that applies very directly to psychedelic work. It's very consistent. They're not at odds at all. So that's just a very convenient, widely available, even if you're quiet, like we were talking earlier, people can't talk about their use of psychedelics or cannabis in traditional NA or AA programs. But even if you keep it to yourself and you're just thinking about the 12 steps, you're doing your little microdosing protocol on the side, or you're having, journeys with a guide and stuff, and you're going to your traditional NA or AA groups, you can apply all the same principles, all the steps, if you care to help you on your journey. And you have that built-in community, which is why I think it's so difficult for people who do share about their psychedelics in traditional recovery program or with their sponsor, and they don't have a sponsor like Vanessa had, who expressed a tremendous amount of humility, say, I don't know, but as long as you're moving closer to the light or whatever you're checking yourself, people have sponsors that say, you're out of here, bud, no, you're not sober. And it's crushing. It's crushing to people to hear that message from this beloved community that's been part of their lives for so long. So it's okay not to share about it in your traditional recovery groups. If you value that community and you appreciate the principles in the 12-step programs, then you don't have to talk about it. It's okay. There are other communities where you can talk about your psychedelic use with your therapist, with PIR, Psychedelics and Recovery, and other places. But community is so important. Having that, being willing to do the work, and the 12 steps are work.
Yeah.
Thanks.
Yeah. Rick, something that you said reminded me of one of the things that we also face within 12-step fellowships in particular is the idea of rigorous honesty, right? And people will sort of twist that to mean I'm supposed to be sharing about all my things. And that's not what it means. It's actually rigorous honesty with oneself. about fully conceding to our innermost selves that we are an alcoholic, addict, or whatever. And that's what that actually means. And so one of the things that I guide people through is I don't share. I don't feel like I'm fighting or lying in a meeting if I don't share openly about my political beliefs, or what I think about abortion, or what I do in my bedroom, or what I talk to my therapist about, or what medications I'm on for what health ailments. I don't live in this, I'm not being honest if I don't do that. And so like I pull in what my sponsor said to me, how you find God is an outside issue. You know, AA in particular is a primary purpose fellowship that deals exclusively with recovery from alcoholism. Anything and everything is an outside issue. And how we seek our healing is an outside issue. And I think another thing that's important to talk about is, I think, Rick, I think you were the one, when is it appropriate to approach these medicines if we are in fact called? And I think that that's part of the intake, right? That's part of the evaluation and understanding where they are on the spectrum of recovery. And Joe, to your point, getting thrown into an ayahuasca ceremony it can be incredibly destabilizing. And so it's my recommendation that whether it is a 12-step program or, the Wellbriety movement or some other community base where, you have sort of some structure, stabilize. Get some recovery under your belt, do the deeper work to get to the other side of that before, and establish the foundation so that you actually have some skills that you will require after a macrodose experience to integrate it. If you do not have the basis, if you do not have the foundation, one, it's either going to just become this cool thing you did in Peru one weekend or whatever. And then what, right? Or you come out of it and all of a sudden you know all this stuff that you didn't know and you are incredibly destabilized and you have a spiritual emergency. Let's not do that. So stabilization is so important. Yeah. I'm loving this conversation. I'm loving it.
In closing this beautiful conversation, I love to ask all of my guests to just suspend reality. There's no gatekeeping, there's no corporate agenda to work around. If you had your dream of dreams and you have a vision for how psychedelics can be woven into modern society in a safe, effective, accessible way, how can you see that unfolding in your dream of dreams? Let's start with Rick.
Thank you. Casey, I also just want to give a huge shout out to the work that you do on a regular basis. I've been following you and your work for at least 5 years on social media, liking your posts, responding, engaging, and the service you provide, what you're doing with people is so important in the way that you do it, which is full of love, full of sensitivity and compassion, just gentleness. And that's so valued and needed in this work. So I just wanted to say thank you. Thank you for the work that you do. And to your question, the dream big when it comes to this stuff. I just believe that it's possible to destigmatize the healthy integration of these substances, these experiences, cutting across all settings. I envision that there are sort of universal principles, ethical standards, just basic understandings of how to work with these tools that cuts across all lineages. I don't care if it's, Western medical or huge respect for indigenous cultures and everything in between, all the underground practitioners, to normalize these experiences, to integrate them with some basic set of standards. I'd love to see, I worked for the Hazelden Foundation, Hazelden Betty Ford, for 7 years, back another iteration of my career. And, they integrated buprenorphine and methadone into their program in Minnesota. And that was a huge sea change for that organization to integrate buprenorphine and methadone into their process. Like, why can't these, something like 80% of all treatment programs across the country have some, incorporation of 12 steps? Why can't there be 100% of treatment programs, recovery communities, peer support groups that can integrate these tools in healthy and safe and effective ways? I believe it's possible.
Gorgeous. Joe, how about you?
I think it's probable. I think these are the conversations that make that stuff happen, and that's what we're doing, right? You talk about, buprenorphine or Subutex or Suboxone and all of that stuff. And I worked at one of the first treatment facilities that started, and they didn't know what they were doing. You know what I mean? But they took the risk, man. You know what I mean? Like, they took the risk, they educated themselves, they took the risk, and they went out there and they did it. I think that's what we're doing, and that's what's happening here. And man, you talk about anything being possible. Yeah, imagine that, right? Like, imagine, people not having to sneak away to Mexico to go do Ibogaine, right? Imagine being able to, get the help, that they need here, and incorporate your family with that and get the support and the love and all of that stuff. Like, just imagine that, Yeah, that's beautiful. And I think the funny thing is you asked 3 people in recovery to suspend reality. And I went right to, I know we're pretty good at that. We all know how to do that pretty well. And I'm coming from the place of, like, let's just make it reality, right? Let's just make this happen. And we are. And again, on the heels of what Rick said, Dr. Rick is like, thank you, Casey. And also, again, I am honored to be a part of this panel. Thank you so much. I've learned so much from you, and Godspeed to all of you. Appreciate it.
Thank you. Vanessa, how about you?
Yeah, thank you. And I'll echo it too. Casey, thank you so much for the privilege and the honor of participating on this panel and being among such incredible company. I'm deeply humbled to be a part of this. And when I think about the dream big, right? And conversations like this are the start of it. And I believe that it already exists. We are just stewarding it in. And that together we can lead a life-saving revolution in addiction recovery by bridging the critical gaps in post-therapy support for individuals engaging in psychedelic-assisted therapy that are trauma-informed, educational platforms that are dedicated to addiction recovery and empowering recovery professionals and institutions, medical practitioners across the entire recovery spectrum, from those who are in pre-recovery and active addiction and people who are in long-term sobriety, and really being committed to transforming the landscape of recovery. So, like Rick said, so that it can be part of the work that we're doing, where it's not stigmatized, and really dedicating to the expansion of normalizing these conversations and educational opportunities, like I said, to set new standards for comprehensive, informed care across the continuum of care for people who are in recovery, regardless of where they fall along the spectrum. And I see this also as part of the eagle and the condor prophecy. We are a part of that. We're a part of that. So thank you so much. What an honor to be a part of this group.
Thank you all so much. I'm going to touch a lot of lives with this conversation. So thank you. I appreciate all of you. if folks want to find support, work with you, how can they find you? Vanessa, let's start with you.
Sure. I do one-on-one work. My website is vanessacreites.com, VANESSACRITES.com. And then I also have an educational platform and group coaching program called Sobriety of the Soul for people who are in recovery, who want to make a safe and informed entry into the spiritual and therapeutic application of psychedelic medicines. And it's an all levels course and community, and that is sobrietyofthesoul.com.
Wonderful. Thank you. Rick, how about you?
Well, Casey, you know that I'm very active on social media, and I think that's often the best way for people to reach me. When Casey is trying to reach me and I'm not responding to my emails, she'll reach out over the LinkedIn direct messages and try to get me there. That's facts right there. Yeah. So, I mean, you can find me on social media, LinkedIn and Twitter X in particular. And, you know, we mentioned the Psychedelic Society of Vermont. That's at vermontpsychedelic.org. vermontpsychedelic.org. And mainly that just shows the conference that's coming up in September, and would love to have people who are, in particular, it's directed towards healthcare professionals to talk about raising awareness for healthcare professionals and giving continuing ed credits. So it's not meant to exclude the general public, and we do make exceptions, but we're really offering these continuing education credits for healthcare practitioners. And so people can reach out to me through that website because I'm the only person that checks the Vermont Psychedelic email. And that's the best place to reach me. Fantastic.
Joe, how about you?
Well, Casey, as you know, I'm not very active on Instagram or any of the social medias, but you can reach me on my website, which is joeschock.com. It's SCHOCK. I am on Instagram, Joe Schock Coaching, LinkedIn, Joe Schock, and old school coaching, mentoring, spiritual growth, microdosing guide, starting a men's group here in August. So, but more to come on that in that venue. But that's it. That's all of it. Thank you.
Love it. Thank you all so much. And we'll put all those links and more in the show notes too, so that people can find you as well. So just wanted to say thank you again immensely to all three of you for your work, for your vision, for sharing today. Again, you're going to change and touch a lot of lives. So thank you for being here. All right. And thank you to all of our listeners. Thank you for being here. And we'll see you back in just a couple weeks. Have a great day. Thank you for listening to today's episode of the Microdosing for Healing podcast. Are you ready to take the next step? Please visit us at microdosingforhealing.com to access our free Microdosing 101 workshop. In it, you'll learn more about our diverse community, our supportive group programs, and discover if earth medicine practice might be right for you. See you in the next episode.